So we've touched on questions, moral issues that relate to communication at several points in this course so far. When we were discussing autonomy, we talked about the importance of informed consent, right? Obviously, consent is not really consent unless somebody has been properly informed and communicated to about various elements of a treatment that's being offered or the diagnosis of the problem and so forth. Okay, so informed consent related to the principle of autonomy. Going back a little bit in terms of moral theories, we had talked about the importance of truth-telling and honesty with respect to Kantian thinking, which would insist that lying is always wrong for a number of reasons, but primarily because we would not want to be lied to. If we would not want to be lied to, then we must not lie to other people in Kantian thinking. So Kantianism and autonomy, the idea of informed consent. We also talked about ethics related to communication. We were discussing paternalism and with respect to the principle of beneficence and nonmaleficence. One of the forms of paternalism is, we might say, soft paternalism or weak paternalism, where we're not directly overturning somebody's autonomy. However, we are trying to kind of nudge or persuade in a certain direction that we know is in a patient's best interest. So that's a little bit of a review of the moments or key points when we've talked about communication in the context of bioethics. But of course, this week we take a deeper dive into issues that relate to confidentiality and truthfulness and privacy and so forth. So one of the things that it's helpful to begin by exploring is the notion of motivational communication, which we had touched on when we were discussing paternalism, when we were discussing weak paternalism, how if, say, a patient refuses a treatment that you know is best for them, we don't simply say, okay, well, off you go, no problem. We might instead say that, well, is it okay if we have a brief conversation about the treatment, and would you mind if I shared a few more details about how beneficial it is, and we'll share a little bit about the side effects and so forth. Much of the time, you might ask somebody what they think, what they imagine the future might look like if they pursue or refuse this particular lifestyle or pattern of habits and so forth. A way of motivationally communicating with somebody. Of course, when we're talking about confidentiality, uh, you'll remember that when we were talking about somebody's autonomy, we uh, we were discussing primarily autonomy over one's own body. But when we're thinking about confidentiality and truthfulness, we're also thinking about somebody's autonomy over information related to their body. So over details about their protected or private health information. Okay, so information about your body has similar moral considerations as your body itself, and your privacy over your information is analogous to your privacy over your own body. So there are various policies that are in place already that are intended to protect that. One of which is HIPAA, the Health Insurance Portability and Accountability Act, which contains something called the Privacy Rule, which effectively insists that you cannot share somebody's protected health information without their consent. Or if you are their treating physician or their treating clinician, then there's sort of implied consent because it's information that you need to know in order to properly treat a patient. So the HIPAA privacy rule relates to those kinds of standards or qualifications for whether information about a patient's health or a patient's health information could be divulged in certain circumstances. A few conditions that we might want to clarify related to the sharing of information or the protection of information might have to do with the idea of, well, keeping confidentiality, especially the idea of, say secrets, right? And whether somebody has a reasonable expectation that you will expose certain kinds of information. Okay, so one of the dilemmas that we encounter is situations uh, where a little bit of half truths or bending the truth or framing something in a way that might not entirely be accurate could nevertheless be beneficial to a patient. And this is a very, very tricky and touchy and complicated and very gray, slippery topic or a subcategory of issues related to confidentiality and truthfulness. Sometimes motivational communication could involve the use, for example, of metaphors or analogies. And ordinarily, those are acceptable because much of the time a patient knows that you're using some kind of metaphor or using some sort of illustration to bring home a point or to help them to understand a treatment or to help them understand some kind of disease. I know somebody who uses the kind of the dandelion illustration to describe cancer. Cancer spreads through the body in a comparable way as dandelions spread their seeds around, and then suddenly you've got dandelions popping up in areas where you might not have expected, but it's because of the nature of metastasis and related to cancer. So you're not necessarily giving a patient all of the technical information about how cancer spreads, but you are giving them a very helpful vision or a visible analogy for how for the spread of cancer and how difficult it is to control once metastasis has occurred. So that's one element of motivational communication. Then that's largely non-controversial as long as a patient knows that again that you're using an illustration and using or say a thought experiment. But there are some times when paternalism can be dialed up a little bit, especially under similar circumstances as we were discussing when a patient is unable to consent. You'll remember when we were discussing the principle of autonomy, when we were discussing informed consent, we were asking about well, under what circumstances might somebody not be able to give consent. So if a patient is unconscious, for example, or if a patient is suffering from advanced dementia, or if a patient is inebriated, or in psychosis. There are lots of circumstances when a patient couldn't be properly informed and therefore couldn't properly consent. And we talked about surrogacy and other ways of the idea of possibly advanced directives or power of attorney, which are alternatives to acquiring direct informed consent, all of which are connected to paternalistic approaches, right? Which are alternatives to direct autonomy. Well, sometimes paternalism can take the form of the modification of statements in order to be compatible with a patient's own worldview. Let's say they're severely misled or they are delusional about, let's say somebody has advanced dementia and there arises the idea that, well, my dead husband, who they forgot that the person is dead, and they say, oh, he's going to be here in an hour, right? Well, as a clinician, as a healthcare provider, as somebody who is involved in the support of this patient with advanced dementia, it may be that you sort of go along with a person's misunderstanding. Now, that's maybe technically that's false or it's misinformation. However, when we're thinking about beneficence and non-maleficence, we may gauge that it's a little bit better to allow this person to continue in their hopefully harmless delusion and temporary delusion that somebody else is still alive, that they're going to be here in an hour, because you might be aware that well they'll forget that they believed that in an hour in soon, and also it would cause less distress to somebody who is delusional or in psychosis or who has advanced dementia. It would cause less distress for you to kind of go along with their belief for the moment, right? And that's all kind of along the spectrum of paternalistic approaches. So this is again, it's very very tricky. I myself have great difficulty thinking about how this could possibly be justified. I have a major problem with lying and deceit. However, there are clear cases where it could be warranted, where it could be morally justified. And I just identified one. You may be able to identify several more. Please do exercise caution, right? Make sure that you are reviewing the bioethical principles. Am I respecting autonomy? Am I affirming the patient's dignity? An important question. Am I doing what is most beneficent to the patient? Am I preventing harm to the patient, right? Am I exercising non-maleficence? These are all important questions to continue to ask when you're thinking about the idea of allowing there to be some misperception or some deception in the course of treatment or in your care of a patient. Please do exercise great caution. Okay, now there's another situation where deception is entirely warranted, and it's very, very common to use deception of this kind. Earlier, we were talking about what we sometimes might call therapeutic lying or therapeutic deception. Again, quite controversial. But another fairly non-controversial use of deception is with placebos. You may have heard of placebos as a sort of fake medicine that you might give somebody. It could come in the form of a sugar pill. Could come in the form of pushing some saline that's not really going to improve or diminish the health of somebody. Yet the fact that you have given somebody something kind of can trick their brain into thinking that they are being given something that will relieve, say, their pain or their suffering, or maybe some kind of a psychological difficulty that they are trying to make their way through. Sometimes the very belief that something can help them ends up helping them, right? So this is called the placebo problem in ethics. It's a problem because, well, you're doing something that is beneficent, it's good, and certainly from a utilitarian perspective. Remember the moral theory of utilitarianism about maximizing the good and minimizing the bad. From a utilitarian perspective, placebos are fantastic. There's not really much more moral problem with them because you're maximizing the good, minimizing the harm in many cases. Well, but when we also want to think about the dignity of a patient and affirming a patient's autonomy, fully informing a patient, then placebos become a little bit morally problematic, right? Because you are actively deceiving and deliberately deceiving somebody into thinking that something's going to help them or that something is actual medicine. Now, one of the ways to kind of get around that, if somebody is in severe pain and they've already maxed out the amount of pain medication that they could have before the side effects start to outweigh the benefits of the medicine. One thing you could say when you're administering a placebo is you can kind of skirt around what the medication actually is or what it actually isn't by simply saying something like, "I'm going to give you something that is known to help relieve pain," right? And that's true. You don't have to that you can say that with really no deception whatsoever. You're just because placebos are known to help relieve pain. So that's one way in which you can find some kind of middle ground between deceiving somebody uh, and uh, uh, and and allowing them to suffer, right? So there can be some kind of middle ground there in confronting the placebo problem. Okay, a couple more things related to. Oh, right. One more element that has to do with disclosure, confidentiality, truthfulness, and so forth is making mistakes, medical errors. So this is something that can be quite sensitive. Much of the time, clinicians, providers would rather not admit that they've made a mistake, but it can't be overstressed that errors need to be documented. And you can imagine, a number of reasons why this is the case. One of them is that if somebody is going through a regimen of medication, say an antibiotic, and one of the doses is accidentally skipped, right? There are some stories. There's a video that I've put on D2L that is a video by a nurse who talks about a couple of mistakes that she made when she was caring for patients. One of them is that she accidentally forgot to put the antibiotic back into the saline, and so the patient didn't actually end up getting that dose of antibiotic. So it could be a major problem if somebody is, trying to, somebody's body is trying to handle an infection, but they don't get a dose, or they miss a dose of an antibiotic. So the documentation is important so that if there does arise a problem later on, there is as much information as possible about what could have led to or exacerbated that situation later on. And then it'll be easier to come up with a proper response medically to that problem. Okay, let's see. So yeah, documentation of mistakes, making sure that you're honest about this. Not only because for reasons that I just described, but also because it will, for you, and this is a bit of an angle from maybe virtue ethics, it will make you a better provider. It'll make you a little bit more aware of those difficult or of those of possible maybe accidental negligence, right? It'll be make you more mindful of how you go about your day-to-day work as a healthcare provider. Okay, it'll just make you better at what you do and make you generally a better person, a more mindful person, right? It'll improve those virtues, those character attributes, those elements of your personality that you're hoping to grow in, hoping to become more excellent at, which is what virtue ethics is all about. Okay, I think that is generally the long and the short of what we would have gone over had we been able to meet today. And so, yeah, I hope this is a helpful overview. Please don't forget there's going to be a quiz related to this content. Please review the items that are listed in detail in this topic, in this chapter on confidentiality and truthfulness. And I will see you next time we meet. Thanks very much for watching, and take good care.